This is Dr. Philip Levin, and today I'm talking about semaglutide, its effects, how it works, and its side effects and warnings. Semaglutide is a new medication approved in 2017 for diabetes control. It works by mimicking a specific enzyme in our body called GLP-1. And how it works is it increases insulin absorption, increases insulin being produced and absorbed, and so the glucose is taken out of the system much more quickly, and it decreases appetite. It's a medicine for people with type 2 diabetes because it lowers the blood sugar. It produces more insulin, though it seems to be effective in type 1 diabetes as well. But besides its use in diabetes, it's also been shown to reduce the risks of heart attacks and strokes in people overweight with diabetes. It's been proven effective. Most patients who use the weekly injection of the medication lose about 2 pounds a week over the first month and can continue to lose weight as long as they use the medication. It's not inexpensive. The general cost runs about $1,000 to $1,500 every month, depending on which brand and your insurance costs. It can be much less. The main focus of my talk today is going to be the side effects and the contraindications and things to watch out for if you are prescribed or taking the semaglutide. The most common side effects are the stomach issues. Most patients will have some nausea, and many will have vomiting and diarrhea. In fact, there's a new warning about the medication that can cause severe stomach problems, problems called gastroparesis, where the stomach just won't empty, or an ileus, where the bowel gets still. Now, that's not common, but when it happens, it's very serious. So those patients who are taking the medications, who have these type of issues with severe stomach cramping and vomiting, they may need to go see their physician or the emergency room promptly. For the most part, though, these side effects calm down after a few weeks. However, there's another aspect of the GI system called the pancreas, which can get inflamed with this medication, semaglutide, and cause a problem called pancreatitis. And the symptoms for pancreatitis is severe burning pain in the pit of the belly with severe vomiting. Now, this also is much worsened with alcohol. Now, alcohol should not be taken with this medication, not only because of the increased risk of pancreatitis, but also because alcohol lowers blood sugar. So if you're taking Ozempic or one of these medications and you take alcohol as well, you may have a marked decrease in your sugar level and have a hypoglycemic reaction. There are 4 different currently approved medications in this class at the time of this film. These include the semaglutides, tirzepatide, dulaglutide, and exenatide. Ozempic, which is the first one approved and the classic one that most people use, and its close cousin Wegovy, which is actually approved for weight loss, while Ozempic was only approved for diabetic control. One of the interesting complaints people are having with this medication is what they call Ozempic face. Because your sugar is going down, you're losing weight on your face. People who had like a fatty face, they tend to get like a droopy face because the fat that was making their cheeks higher and such is gone now, and so it's called Ozempic face because they get a little droopy face. It's not a serious side effect, but it's something that some people are bothered by. Fortunately, for the most part, besides the stomach issues, there's very little side effects from this medication. It doesn't affect the liver. It doesn't cause hair loss. It doesn't affect people's hormones. Now, some people have reported some depression with the medication, and of course, anytime anyone has a depression from any source, if you get so bad as to feel suicidal, you definitely need to get help right away. Now, there's some relative contraindications or specific dangers to look for when taking these medications. People who have a history of thyroid disease, particularly thyroid cancer, must be careful because there seems to be a correlation in people who've had thyroid cancer or who have family history of thyroid cancer to increase the risk for that. In people with chronic kidney disease, it may cause an acute kidney shutdown. That's, again, uncommon, but there's several case reports of that. It's not clear what may happen to women who are pregnant or breastfeeding, so we recommend in those situations not to take the medication. And of course, if you've ever had an allergic reaction to this medicine or one of its other cousins, you would not want to get back on the medication. There's also some reports of blurred vision that may be related to the sugar reactions within the medications, but those people who have eye problems should check with their doctor first. The medication comes in different types. Most of them are injections, though there is one pill. The medicine Rybelsus is an oral tablet. Those who are taking it as injection can inject it anywhere they'd normally do injections, on their arms or thigh or stomach. If you're also taking insulin injections, do not mix them in the same container and the same syringe, but you can give them near each other in time as long as they're in different sites. There's a tremendously long list of medications that can interact with semaglutide and its cousins. Rather than listing them all in this narrative, I'm going to let it run across the screen for a moment and just basically remind people that they need to check with their physicians before they start taking a new medication, make sure it doesn't interact with any of their other medicines. Some of the main ones listed here are those that cause stomach irritation, like aspirin and nonsteroidals. So it's just can be an added effect on stomach problems. One final note on caring for the medication. Once it's been opened, it needs to be kept in the refrigerator but not frozen. It can be kept in the refrigerator for up to 2 months. And when you're storing it, do not store it in a syringe with a needle because the medication can leak out from the needle. This has been Dr. Philip Levin discussing semaglutide and its cousins and how it works for weight loss and controlling your diabetes. Thank you for watching, and I hope that you'll subscribe to my YouTube videos. Thanks.